Hello, we are learning about hyperkalemia today. Hyperkalemia, which literally means an increased concentration of potassium in the blood. So, why is hyperkalemia important? Before we learn that, the concentration of potassium in the blood is usually 3.5 to 5.5 millimole per liter. So, this is basically an average. So, a potassium concentration of 6.5 millimole per liter is a medical emergency. So why? If you remember, neurons fire the action potentials when electrolytes rush into the cells. When sodium rushes into the cell, the neurons fires up and then potassium leaves the cell. So it's the way cells communicate between each other. So if you increase its concentration of potassium, this finely tuned, chemical and electrical balance of the conduction system is lost, and then it causes all sorts of problems. So if you see, hyperkalemia causes myocardial infarction, which is basically death of the myocardial cells, and it also causes fatal arrhythmias, especially ventricular arrhythmia, which is very dangerous and toxic. So, why do we want to learn about hyperkalemia and what causes it? If you remember, um, when there's a muscle disease, lots of potassium is released into the cell, or when there's damaged red blood cells, a lot of potassium is released into the bloodstream. When there's also a kidney failure, there's a lot of potassium excess in the blood as it's not excreted. But our main goal in this lecture is to learn about medicines that cause hyperkalemia, because our focus is learning about medicines and how they cause hyperkalemia. So, a lot of drugs cause hyperkalemia, including spironolactone, amiloride, candacertan, ramipril, eplerenone, sandoke, cyclosporin. So, in a nutshell, it's ACE inhibitors, angiotensin receptor blockers, potassium salts, um, trimethoprim also causes some hyperkalemia. Cyclosporin causes some hyperkalemia as well. So this is short acronym which you could use to remember drugs which cause hyperkalemia, which potassium salts like Sandoke, angiotensin converting inhibitors like ramipril or lisinopril, angiotensin receptor blockers like candacertan, olozartan, cyclosporin. You could use PAC to remind you of drugs which you should never use together. Using a potassium sparing diuretic with, say, um, aliskiren or ACE inhibitor with angiotensin receptor blocker is extremely dangerous and fatal. It could result in fatal ventricular arrhythmia. So, just for fun, fact, um, to emphasize the risk that hyperkalemia, that you need to respect and what it causes, it's actually used to stop the heart of convicts where capital punishment is served. So basically, if you inject, um, they usually inject sedatives like phenobarbital and barbiturates, and then they use, at last, potassium injection to basically stop the heart. So, if you think about it, you could stop the heart by causing hyperkalemia. For example, administering drugs that cause hyperkalemia together. So, you need to be very careful. And if you see written down on prescription, you need to query whether this is used deliberately and it's for from specialists. Otherwise, you need to alert the prescriber.